Hi guys, it's Mark Fleener and it is early morning here in Lexington, Kentucky, and I thought this would be a great opportunity for me to be able to sit down with a cup of coffee and kind of think and reflect and talk a little bit about myself and my philosophy in nursing. This coming January I will celebrate 6 years as a nurse. At 40 years old, I made a midlife career change, left a 22-year history in retail, and decided to pursue my passion, which was to go into nursing. I am currently a trauma surgical ICU nurse here at the University of Kentucky and continue to find myself amazed every day that I go to work in how much I enjoy being a nurse and being a part of this profession. I think one of the most important roles in nursing is our ability to advocate on behalf of our patient. I feel of any member on a healthcare team, nursing is probably at the most intimate level in providing this patient advocacy. I think it is our responsibility to build that kind of relationship that when a patient is not able to fully extend their desires and their well-being, that it's really the nursing role that really intercedes and carries the wishes of the patient through the healthcare setting to make sure that we optimize the best outcome for them. I think we can pretty much agree that our world is ever changing, and I think we can also agree that our patient populations are probably more diverse than they've ever been. And this can be a big factor in providing patient care. And I think it's more important than ever as a nurse or a healthcare team member is that we're always constantly challenging ourselves to be culturally competent. Are we really trying to become in tune to our patients' needs based on their cultures, their societies, their language, their economic status? And are we extracting all of this when we are trying to provide our care and to ensure that all those are sensitive factors in how we provide the care and provide the best outcome for them? I think, when we talk about providing culturally competent care, you're going to have to parallel ethics and moral issues. And as healthcare team members and nurses, we're always having to consider these different value systems from our diverse patient populations. And some of them may come from very different traditions, and because they don't necessarily mirror our traditions or our values, it doesn't necessarily there's one better than the other or one more right than the other, but it's really about giving our patients the autonomy and ensuring that their rights, that there's no external factors that buffer them from being able to make their personal choices and how they want to live their lives and be able to be the optimal human that they wish to be. I think beyond being a strong patient advocate and providing culturally competent care, I think the biggest role beyond that for the nurse is a great educator and teacher. And I think it's because we are at that intimate level in patient care, we are at bedside, and we've developed that relationship, that it is essential that we're able to give our patients the power through knowledge and education to be able to return back to their communities, be able to kind of face the barriers that they may still continue to have with their illness or disease, but hopefully be able to optimize their potential and be strong members of their families and their communities.